So I haven't really gotten a hang of this whole video editing thing either. I did make, this is the third video I have made this morning. It took me a while to get to the point of why I started this. Okay, so I've always had some, what I thought was swimmer's ear back here. Every now and then in the morning I'd wake up and huge lymph nodes, whatever. I do have, we were talking about spinal problems yesterday, and I had some neurological issues. I just attributed it to rapid weight gain post steroid treatment, and my back cannot handle a lot of weight, so it already bugs me. But you know, I've been losing it since I've stopped the steroid treatment. But at any rate, I was going somewhere with that. Oh, I wasn't certain if the spine issues that I was having was rate related or if we were developing some new problem. So I had some routine spine scanning done that I was supposed to have done 2 years prior anyways. I just hate paying those fees. But, you know, lucky for me, I had maxed my out-of-pocket. I don't know if I should be saying that publicly. Anyway, whatever. So I had it done. And in the MRI, they found what they said was an almost 3 centimeter mass in my parotid tail, which is somewhere, I mean, I feel a lump or a mass if I put my head down back here. Oh, and it kind of hurts. But the doctor can't palpate it because of the torticollis muscles in the area. They kind of override access to the gland. So the MRI wasn't certain if the lymph nodes nearby were inflamed, or if that pathologic mass is what they called it, or lesion, neoplasm, whatever, was within the parotid tail or near. It just, because it kind of looked like a bit of a shadow, and it had an odd, it looks like a ring or a big, you know, like a finger. It's not like a round. It has irregular borders and something called septations in the center. I believe. I don't know if you can see this. No, you can't. But anyway, it's over here, and so it kind of comes around like that. I'll have to try to find a way to get a picture and put that up there. But for those of you that do have to go through this crap, I have a folder. And then I keep, anytime I have imaging done, I ask for the disc before I leave the clinic. Doctors will love you for that, because even though you have a radiology report, they look at discs themselves. Remember, they see these things in surgery all the time. So I also keep copies of all my radiology reports. So, as you can see here, parotid gland mass, something, excision recommended. The first one from the MRI, pathologic, as you see, it's not as clear. Just, oops, is that right? Sorry. Pathologic mass, blah, 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 blah. Looking at C not excluded. The MR radiologist actually contacted my orthopedist about that on the phone before sending him the report, because he was really concerned about it. Orthopedist said he wasn't the GP, so he would need to be a GP issue. Though he went ahead and transferred or referred me to an ENT named Dr. Evans. I already knew, I could read the report and know what needed to get done. So I had my GP. He was really good about just, he knows I'm not stupid, so he will, when he sees things, he knows, you know, I need to order, just send me the order, please. So he ordered the CT with and without contrast in the neck area, CT with and without contrast in the head, because a bone PET came back some kind of focal tracer uptake in the left calvarium. I wasn't worried about that. I have lupus. I have calcium deposits everywhere, so it didn't look anyway. And in the bone PET, they saw some degenerative changes. They did a bone PET because there was an odd lesion on my T6 vertebrae, and they were concerned about that, but it was benign. But the CT scan with and without contrast of the soft tissues of the neck can see parotid masses much easier than just a default MRI for some reason. When I went looking online, it looked like patients that had had CT scans, they will give them an MRI as well. So I guess there's good information out of both. The CT showed the mass that I showed you. We, the next day, just happened to get an appointment with Dr. Evans. What I had read and what I had been told up to this point is that those masses have to come out one way or the other, period, end of story. So I asked some questions about that, and when we do have an excision, there will be a scar from here. It will cut here, back up through here, and then down to here. And then they will peel this back and take the tumor out and surrounding tissue, and then sew it up. He said the scar will look better than this. It will look like it's a facelift scar. Very, very nice. He's done a lot of these, but he says mine is going to be challenging. And he wanted to do, it's controversial, but he wanted to do a fine needle aspiration simply because the mass has an odd presentation. Even though he thinks it's one of the most common benign adenomas, or I can't remember what you call it, phenos something else or other. I'll pull it up later. He said he couldn't do the aspiration within his office because of the complexity of the muscle anatomy here. And the way the mass in is, it's like this way, so inside. So hospital calls me, and he made this thing sound like a walk in the park for starters. So I was like, just stick it in there. Can't you like make a slit? You know, get one of those dental things, just suck it out or something. You know, stupid, but that's how I act when I'm scared. Anyway, so Louisville Medical Center calls me. I'm scheduled for Tuesday. It's not going to be as simple as he said. He said it was just going to be ultrasound-guided fine needle aspiration. No, it's going to be a 90-minute procedure. It will involve an ultrasound and some form of tissue removal, but it's not the surgery. It's the biopsy. But I'll be asleep. I think they just want to make sure that they get really good visualization on the tumor and are able to get several samples of tissue. I asked the doctor, since you have to remove it, whether it's benign or malignant, why go through that? Why put me through that? And he did mention that in this case, especially because there's some, you know, it's going to be a challenge, it's better to know if it's malignant ahead of time, because if it's malignant ahead of time, he would need to remove the entire parotid gland, which, you know, it's fine. It's not a big deal, but they would have to do a little reconstruction over here if they did that, so that I wouldn't just have like this, you know, dent there. I'm already Frankensteined enough as it is, so I appreciate that. And also, if it was malignant, they would remove all of the surrounding lymph nodes, regardless that they don't appear to be problematic right now. They just do it. There is also, even if it comes out to be benign on the FNA is known to be wrong. When they do the operation, there will be a pathologist within the OR to look at the mass, and if the mass appears to be malignant under the microscope, they will proceed with a total parodectomy and lymph node removal. At worst, there would be some follow-up radiation, but the prognosis is pretty good. Mine does not appear to be wrapped around the nerve. Well, and when I get more information, I will let you know. Thanks.